It's time for my ICU shift recap, so let's recap my shift. This is shift 1 of 2, and I was doing charge nurse this shift in the ICU, and unfortunately, we normally have 5 charge nurses for all the ICUs. All the different ICUs should have their own designated charge nurse. However, there were only 2 of us this day, so I was overseeing about 50 ICU patients. Started off by getting report on some of them, could not get report on all of them. That would just be a lot, but went around and said hi to most of the nurses. A nurse called me. They had to go to a stat CT scan and their patient was on CRT, and she was like, hey, while I'm gone, can you prime my filter for me so when I get back I can put the patient right back up on? And I was like, of course. So went and primed the CRT filter. Then we had a rapid that was called, a patient had like pulled out their chest tube, but I went there and they actually already had it taken care of. They didn't need me, so I left. I helped transfer a patient out of the ICU, and then when I got back, I stripped the room for the nurse and then spent some time looking for the VRI. The VRI stands for Video Remote Interpreter, I think, something like that. We could not find it. We needed to interpret for a patient, and we only had, I guess, one that we were sharing between all the ICUs, which is just crazy to me. I did have to take a patient of my own for a little bit. We had a post-op patient that needed to come to the ICU, but we had no ICU beds available. So for a bit, I had to take that patient over in like the PACU and just do like the post-op stuff, assessments. I helped set up a vamp on the A-line, change the dressing on the A-line, gave some pain meds, just some like basic post-op stuff. Rounded on the other ICUs, and then I gave one of the secretaries a break for lunch, and then a nurse needed help cleaning up their patient and starting an IV. I helped break another nurse for lunch that had like just a busy assignment. It ended up starting some levo on their patient while the nurse was gone, gave some pain meds. I took my lunch break later on, but ended up getting a call midway through my lunch break that there's a really unstable patient that needed to go to CT, and the nurse needed an extra set of hands. When I got back from that, a nurse needed help with an ultrasound IV, and unfortunately I could not get it. It makes me so mad when I can't get them. I know I should be easier on myself, but I've improved so much on it that when I don't get one now, I'm like mad. But it happens. This patient had the tiniest of tiniest veins ever and also had limb restrictions, and so I just was limited. Had to transfer another ICU patient to a different ICU. We were just swapping ICUs for that patient, and so helped transfer that patient, and then started getting updates, but a nurse needed help cleaning up like a really massive situation. So went and cleaned that patient up with that nurse, then finished updates, and I gave report and was out of there. And that was my ICU shift recap.